Here we have the gracilis, otherwise known as the gristly inner thigh. It inserts on the inferior ramus of the pubis. And then it comes all the way down to the pes anserine on the medial condyle of the tibia. It's responsible for adduction, and it can also flex. So here's the sartorius. You can see it originates up here on the anterior superior iliac spine, boom, boom, and it comes down and here on the medial portion of the tibia. It is responsible for abduction, so boom. And it can also flex the knee, yay, and medially rotate the hip. And here we have the quadricep muscles. The lovely vastus lateralis is the most lateral of all quadricep muscles. You can see it inserts here on the greater trochanter of the femur, comes on down here. It joins a little tendon across the patella, inserts down here on the tibial tuberosity via the patellar tendon. It is responsible for extending the knee and stabilizing the joint. And here we have the vastus medialis. It also inserts up here on the greater trochanter of the femur, comes on down medially, and again, it inserts down here on the tibial tuberosity via the patellar tendon, also responsible for extending. And here, beneath the rectus femoris, you'll find the vastus intermedius. It is, again, originating up on the greater trochanter in the anterior portion of the femur, comes on down to the tibial tuberosity via the patellar tendon. And it's responsible for knee extension. Here we have the rectus femoris. You can see it's originates up on the anterior inferior iliac spine, comes on down here, similar to all the other quadricep muscles, and it comes over by the little patellar tendon and attaches to the tibial tuberosity of the tibia. Again, it extends the knee and stabilizes the knee joint. All right, here we have some commonly known as hamstrings, posterior muscles of the thigh. Biceps femoris has two heads, starts over here, ischial tuberosity, originates up there on the long head, but also you have the short head, which is on the linea aspera, cut out on the shaft of the femur. Comes on down to the lateral epicondyle, looks like, of the tibia. It is responsible for flexing the knee. It can also extend the hip. Okay, so here we have the semitendinosus and the semimembranosus. You'll notice that the semimembranosus is more medial. Anyways, so they both originate here on the ischial tuberosity of the pelvis bone, pubic bone. No, ischial. I take it back. It's the ischial. Ischium. Thank you. And then they come on down here to the medial head of the posterior tibia. It's responsible for knee flexion as well as hip extension. Here we have the muscles of the lower leg in red. You'll see the tibialis anterior attached over here on the lateral condyle of the tibia. Runs all the way down, kind of right next to the tibia the whole way. So the first metatarsal and cuneiform bone, it's responsible for dorsiflexion. So when you're going here, you're pulling your foot towards you. It also helps with inversion.
Here we have the extensor hallucis longus. This originates at the middle of the shaft of the fibula, as well as within the interosseous membrane in between the tibia and fibula. It comes down here and inserts on the dorsal side at the base of the distal phalanx of the big toe. It's responsible for extending the big toe like this and assists in dorsiflexion of the foot, pulling the foot towards yourself. Here we have the extensor digitorum longus. It originates up here at the anterior lateral condyle of the tibia and in the interosseous membrane within the tibia and fibula. It inserts at the dorsal surface of the middle and distal phalanges, between the middle and distal phalanges of the lateral four digits, and it connects into tendons that go out to the distal phalanx of the toes. And the extensor digitorum longus is responsible for extension of the toes up like this and dorsiflexion of the ankle.
All right, so here we have the soleus. It's a very nice slow twitch muscle fiber. It originates here on both the tibia and the fibula, kind of like on the ridges and the shaft. Comes down, joins its friend the gastrocnemius onto the Achilles tendon all the way down to the calcaneus. It's responsible for plantar flexion, so raising the body. Here we have the gastroc, and you can see it originates, it's a fast twitch muscle fiber. It originates on the lateral condyle of the femur. So it's all the way up here. We didn't put it up there just because he wouldn't be able to move, of the femur. So it's biarticulate. And then it joins its best friend, the soleus, down on the Achilles to the calcaneus. Gastroc's kind of fun because not only does it plantar flex, it also flexes the knee. So when these are both extended, it's stretched.
On the posterior side of our calf muscles, we have the tibialis posterior, which originates on the tibia and the fibula at the proximal shaft and within the interosseous membrane in between the two bones. It comes down here and meets our Achilles tendon that goes down past our calcaneus and actually inserts in the medial cuneiform bone and the navicular bones, which are down in here on the bottom side. You can't really see the connection that well. And the tibialis posterior is responsible for inversion of the foot, so the foot goes this way, and plantar flexion. The flexor digitorum longus originates at the posterior surface on the body of the tibia and inserts down here at the base of the distal metatarsals 2 through 5 on the dorsal side of the foot. This muscle is responsible for flexing phalanges 2 through 5, so flex toes like this. Next we have the peroneus longus and brevis. It originates on the lateral side of the mid shaft of the fibula, and the longus inserts down here at the first metatarsal, whereas the brevis inserts at the medial cuneiform down here. And this muscle is responsible for plantar flexion, which is this, down, and eversion of the foot, which is this way. And last, for our calf muscles, we have the flexor hallucis longus in here. This muscle originates on the posterior shaft of the fibula and comes down here and inserts on the plantar surface at the base of the distal phalanx of that first digit. And the flexor hallucis longus is responsible for flexing all of the joints of the big toe and for plantar flexion of the foot. And now we have our deep muscles of the back. We'll start with the spinalis, which originates at the occipital bone, at the base of the occipital bone, in between the inferior and superior nuchal lines, and it comes down along the spinous processes of the thoracic vertebrae and inserts into the aponeurosis of the sacrum, which is a lot of tendons and other muscles sort of meet down here, like the longissimus, which also, coming under here, originates at the base of the occipital bone, and as it comes down along the back, it connects to the transverse processes of the vertebrae, and also connects down into the aponeurosis with the spinalis. And also we have the iliocostalis, which originates on the occipital bone, on the lateral side of the occipital bone over here, and comes down to meet these other back muscles at the aponeurosis of the sacrum. The actions of the spinalis longissimus and iliocostalis involves lateral flexion of the spine as well as extension of the spine and keeping the body standing upright, and helps with our posture. And I mentioned before the iliocostalis originates on the lateral side of the occipital bone. It's actually the mastoid process. Moving on to the next layer of posterior back muscles, we have the serratus posterior inferior, which originates on the spinous process of thoracic vertebrae 11 down to lumbar vertebrae 2 and inserts on the inferior borders of ribs 9 through 12. And this muscle is responsible for depressing the lower ribs during expiration. The semispinalis capitis originates at the cervical spinous process of cervical vertebrae 7 and inserts on the occipital bone in between the superior and inferior nuchal lines. And this muscle is responsible for extending, rotating, lateral flexion of the head and spine. The serratus posterior superior originates on the spinous process of C7 down to the spinous process on thoracic vertebrae 3, and it inserts on the upper border of ribs 2 through 5, sort of under the scapula here. And this muscle is responsible for assisting in forced inspiration of the ribs. We have the splenius capitis next, which originates at the spinous process of thoracic vertebrae 1 through 3, kind of down in this area here, and it inserts at the lower nuchal line of the occipital bone, and this muscle is responsible for extending and rotating the cervical spine. Now we have the superficial muscles of the back in pink. The trapezius originates at the spinous process of the vertebrae down to thoracic vertebrae 12, and also at the base of the occipital lobe, and it inserts at the lateral border of the clavicle around here. And the trapezius is responsible for laterally rotating, elevating, and retracting the scapula. Latissimus dorsi originates at the spinous process of thoracic vertebrae 7 down to lumbar vertebrae 5, as well as the inferior angle of the scapula down here. It's not connected on Buster, but connects right down here, and it inserts at the bicipital groove of the humerus right under here, which it's not connected on Buster as well. And the latissimus dorsi is responsible for adducting the arm, medially rotating the arm, and extending the arm. Moving into the abdomen, we have in green here the rectus abdominis, which originates at the pubic crest and the pubic symphysis right here, and it inserts at the costal cartilages of 5 through 7 and the posterior aspect of the xiphoid process, so it's actually right back there. And the rectus abdominis is responsible for flexing the trunk, and it aids in expiration. Okay, moving on with our abdominal muscles. Our deepest layer would be our transverse abdominis, and then we have our internal obliques and then our external obliques, and these sort of wrap all around in this trunk area, and so they originate on the inferior borders of the ribs, and they insert into this aponeurosis, which is this whole area, and the rectus sheath, which kind of makes up the six-pack. And they are the external oblique and the internal obliques are responsible for supporting the abdominal wall, and they aid in forced respiration, as well as AB, abduct the trunk and rotate the trunk. And the internal obliques also sort of originate within the lumbar fascia and kind of come down to the iliac crests, but it was just sort of hard to put that on little Buster here.
All right, here we have the psoas major, major hip flexor. It originates over here on the transverse processes of T12 through L5, and it comes down and inserts on the greater trochanter of the femur. It's responsible for flexion at the hip joint. We have the iliacus. It originates here on the upper 2/3 of the iliac fossa. Comes down, attaches at the greater trochanter of the femur. Consequently, is responsible for hip flexion. Boom.
Within the thorax, we have the internal intercostals, which originate on the inferior border of the rib and insert on the superior angle of the inferior rib. And we also have the external intercostals, which originate and insert at the same type of setup as the internal costals, but these are just more external and these are deeper. And the internal intercostals are responsible for depressing the ribs for expiration, and the external intercostals are responsible for elevating the ribs, which aids in inspiration.
And here's the surprise under the trapezius, is the serratus anterior. It's kind of weird because it originates on the front here, on the on the ribs like 8 through 9, or the top 8 to 9 ribs, and then it comes back here, and it attaches kind of on the medial or on the lateral border, kind of the costal border here, and what it does, it protracts, it goes on the scapula, and also stabilizes it in upward rotation.
Here we have the pectoralis major. This originates at the medial border of the clavicle where it meets the sternum and is also connected to the first 7 ribs at the intercostal cartilage. It inserts at the crest of the greater trochanter of the humerus. Tubercle of the humerus, and is responsible for flexing the arm, adducting the arm, and medially rotating the arm. Underneath the pectoralis major, we have the pec minor. This muscle originates in the intercostal cartilage of ribs 3 through 5, and it inserts at the superior surface of the scapula, so sort of back through under there, and then right up in here, the superior surface of the scapula is where it inserts. And the pec minor is responsible for stabilizing the scapula, and it raises the ribs during inspiration.
And here, deep within the abdomen and thoracic cavity, we have the diaphragm. You can see it attaches all throughout these ribs, also back onto the vertebrae, also onto the sternum, the xiphoid process here. Its main function is to help with inspiration. As it contracts, it pulls the lungs down, creating a vacuum so the air flows in. It also serves as a separation between the thoracic cavity as well as the abdominal cavity. Very important in separating all the goods in there. Thanks for watching our presentation. Bye!